Okay, today I want to talk about chapter 27. This is your substance abuse and associated problems chapter. It's the last chapter. Aren't you excited? Yay. So, substance abuse or chemical dependency, we used to call this addiction. Now we call it substance abuse. It is the abuse of chemicals, prescribed or illicit, and leads to what? Lots of changes. Changes in behavior, changes in relationships, changes in the ability to sleep, your sleep patterns. Employment can be affected. Health problems can develop, and possibly even death can result. Terminology that we're going to use: substance abuse or chemical dependency. Those are the broad terms we now use for inappropriate use of drugs or chemicals. We know that this impairs function in some way and even causes euphoria, that high that substance abusers feel. It is a habit. A habit is a practice of using substances at regular and frequent intervals. And then there is dependence, which is where your body physiologically and psychologically craves the substance. Other terms: physiological dependence. Discontinuance of the substance will lead to withdrawal. Psychological dependence, that belief, that desire to take the substance in order to function. Tolerance is where your body has adapted to the substance, and much more must be taken to get to the same effect. Addiction is that older term we talked about. More serious forms of abuse are addiction still. Modes of action. In the central nervous system, we have depressants such as tranquilizers, alcohol, cannabis. Narcotics are also CNS depressants, and these are usually your painkillers. Stimulants such as coffee or amphetamines. Psychedelics such as hallucinogens. Sources can be legally prescribed medications: tranquilizers, sedatives, painkillers, any medications that has been prescribed to one person and shared with others without a prescription. Prescriptions can be obtained from a lot of different sources. Doctor hopping to get medicines from a lot of different people, the same drug. And medication can be combined with other substances to enhance their effect. There are lots of things that are readily available without any restrictions, and those are the sleep-inducing or wake-up pills, cough syrups and decongestants, caffeine, other examples: spray paint, shoe polish, alcohol-based hair lotions, glue, nail polish remover, aerosol solvents. Lots of different things have substances that can be abused or can enhance abusive substances. My voice is going. Whoo, sorry. Illegal or street drug can be costly and can be dangerous. You don't really know what you're getting in one pill or one shot or whatever. And so many times that in and of itself leads to an unintended overdose. These drugs are usually better known by common names rather than a medical or a chemical name. They can be sniffed, they can be smoked, they can be taken orally, they can be injected. There are many different ways of taking these substances. Many are manufactured from inexpensive chemicals, but chemicals not intended to go in your body a lot of times. And they're often diluted with contaminants, with toxins. Environmental and behavioral risk factors. These are just a few examples. There's a lot of examples in your textbook. So, and you guys probably know more about these than I do. So I led a very sheltered life. Anyway, substance abuse is becoming more and more common in young adolescents. Parents' medicine cabinet is a common place to find drugs, especially prescription painkillers and other drugs that adults may be taking. Mixtures of drugs without knowledge of what was consumed. change in the complexity of society. Families are breaking down, economics factors are present. There's just a lot of ways that our society is changing, and with that, it opens the door to some of these abuses. Other categories of drugs, anabolic steroids, and I know you've all heard of doping athletes, athletes that abuse them in order to build up their muscles. These are going to be some sort of hormone or steroid, probably, especially competitive sports. And it's not just males, this includes females. I know you've all heard about, been warned about, dealt with date rape drugs. They are illegal, and this is a premeditated assault. This is an intent to assault, and so that makes it an even worse crime. Date rape drugs mixed with alcohol can cause CNS depression and a very deep sleep, and the person drugged will have no memory of what happened, so that it's difficult for that reason to bring charges. Recognition of abuse is hard. Pattern of consumption varies, frequency, large amounts periodically, binge drinking, for example. Some individuals are affected by a small amount. Others can function very well with a very high amount of drugs or alcohol in their system. Combinations of chemicals usually exert a more marked effect. Depressants decrease the level of CNS function. They also decrease your inhibitions socially. So you may say or do something out in public, at a bar, at a restaurant, at a dance, that you would not have done if this drug had not been in your system. And then, of course, stimulants increase CNS activity. Complications, of course, number one is overdose. We hear a lot now about Narcan and who can carry Narcan and how we can take care of that. So it's a common problem. It's an acute problem. There's a very small margin of safety, margin of error for some of these drugs. So the tiny little bit extra and you have overdosed. A lot of street drugs are contaminated. They're cut with different things that weren't necessarily meant to be ingested. And we don't really know a dosage. There's no control of these drugs so that there doesn't have to be a certain amount in any one pill or shot or whatever. And we know that some of them are synergistic, that smaller amounts of two or three different things will have a stronger reaction than any one individual thing, even in a larger amount. Withdrawal is another complication where the drug is discontinued. Usually it is discontinued suddenly. It's caused by a physiological dependency. It can be mild to severe depending on the drug and depending on how long the person's taken it. Things can be seen like tremors, irritability, nausea, vomiting, stomach cramps, psychotic behavior, convulsions, high blood pressure. Some of these things are not reversible if they've been there for a long period of time. Pregnancy can be affected. Abusers won't probably seek prenatal care because they don't want to be found out. And so they may come in to be delivered having never had any pre-pregnancy care. And a drug screen will show that they have some positives. Many substances, lots of different things can affect the fetus. We know fetal alcohol syndrome, for example. But there are lots of different drugs. Some drugs, even though they're pretty significantly severe drugs, have less of a long-term effect on an infant than others. My daughter is adopted, and her birth brother tested positive for, I can't remember what, honestly. I know one was marijuana, and I believe the other one might have been, I don't know. I don't remember for certain. But the pediatrician did tell us that they had fewer side effects than some of the other drugs that she could have been taking and wasn't, or at least didn't show up in her blood. Cigarette smoking and even secondhand smoke affects the rate of stillbirth and spontaneous abortion or miscarriage. It can lead to low birth weight infants as well. Cardiovascular problems can happen. Cocaine, amphetamines, any other stimulant that also will stimulate the heart, it can cause irregular heartbeats, increased blood pressure, heart attacks, strokes, and heart failure at a young age. And if you listen to the news very much, you hear about these every other week or so, sadly. Infection is another one. Malnutrition, just everything is about the drugs. Malnutrition is a problem. It reduces the host resistance. And with that decreased resistance, then infection has an opportunity to come in and take over. Local lesions where a drug may have been injected can become infected. Again, there's an avenue in for bacteria. There are systemic effects that are common in users and needle sharers. Hepatitis B, HIV infection, you guys know about. Other complications, psychological and neural effects, hallucinogenic drugs. Hallucinogens have an increased, unreal, distorted interpretation of what's going on, of what's really out there. What is nothing to you or I will seem as life-threatening to this person who's on a hallucinogen. They may have unpleasant episodes with combinations of fear, panic, depression, and they are at increased risk for suicide. Physical effects, increased blood pressure, nausea, tremors. Ecstasy is a drug that can lead to cardiac arrest or even death because of dehydration. Other things, memory impairment, distorted judgment, high risk behavior. Alcohol. Alcohol is a serious drug with serious consequences. Cirrhosis of the liver is one of those occurring in chronic alcoholics with long-term or with acute excessive alcohol intake. You can see the ramifications there. Nervous system damage. These are things: Wernicke syndrome, confusion, disorientation, loss of motor coordination, and Korsakoff psychosis, altered personality, and amnesia. Look at these, read about these in your book. Some of them are not reversible, and so they really indicate that a person has had an alcohol problem, a pretty serious one. What else? Treatment. Overdose for the toxicity of the immediate effect of the drug. Usually in the emergency room, the Narcan now that some policemen are carrying that will counteract most overdose substances. Withdrawal, a person needs to be admitted to a unit for that, probably. It can be very traumatic and even life-threatening. Supportive care is required to prevent complications. Therapy. Therapy needs to be in the form of monitoring, support, counseling, behavior modifications, support groups. If a person is in a unit, they're going to do a support group every day. They'll do group, they'll do individual counseling. There will be activities. There will be things they can't talk about. Okay, I believe that's it.